Muscles of facial expression can be divided into groups depending on the anatomical location. We're going to have 1 muscle in the scalp, 3 around the eye opening, 10 around the oral opening, 2 around the nasal opening, and 3 around the ear opening. And so all these muscles have a few things in common. And the first one is that all of the muscles of facial expression insert at the skin, and they produce wrinkles in the skin once they contract. Another thing they have in common is that all of them are innervated by the facial nerve, which is the cranial nerve number 7. And the last thing is that they all come from the second pharyngeal arch during development. So now that we have kind of a general overview of the muscles, let's start with the muscles of the scalp, which is the occipitofrontal muscle. This is a flat muscle located on the top of the scalp. It consists of the occipital belly, which originates from the highest nuchal line on the occipital bone, and it inserts at the epicranial aponeurosis or Galea aponeurosis. Then, more anteriorly, you will find the frontal belly, which originates from the epicranial aponeurosis and inserts at the skin of the eyebrow. The function of this muscle is to pull the skin of the forehead up, forming horizontal lines on the forehead, as you see here. And the occipital belly's main function is really stabilizing the aponeurosis and tensing it. Next, we have the muscles around the eye opening, and these include the orbicularis oculi, procerus, and the corrugator supercilii. The orbicularis oculi is a circular muscle, as you see here, consisting of 3 parts. These are the orbital part, which is the peripheral part of the muscle going around the eye, the palpebral part that covers the eyelids, and the lacrimal part for the lacrimal sac. So the orbital part is this one. It originates from the medial palpebral ligament, then goes around the whole eye in a loop, and then inserts at the medial palpebral ligament again. The medial palpebral ligament is just a small ligament located on the medial end of the eyelids. The palpebral part, again, is the part that covers the eyelids. They originate from the medial palpebral ligament and insert at the lateral palpebral ligament. And here, just to visualize it, here is the medial palpebral ligament, and here's the lateral palpebral ligament. So the palpebral part of the muscle goes like this. The function of these 2 parts is to firmly close the eyelids and creating wrinkles extending outwards from the lateral angle of the eye, as you see here. The lacrimal part, however, originates from the lacrimal bone and insert at the lacrimal sac, and it's located in this region. And what it does is that it dilates the lacrimal sac, which aids the drainage of tears from the eyes down through the nasolacrimal duct and then down into the nasal cavity. So tears are produced by the lacrimal gland, they go to the lacrimal sac, and this muscle really just opens up this lacrimal sac so that the excess tears can flow down into the nasal cavity. So that is the orbicularis oculi. Next, we have the procerus muscle, and the procerus muscle is located between the eyebrows, as you see here. It originates from the bridge of the nose and inserts at the skin of the forehead, forming a horizontal wrinkle on the root of the nose, as you see here. Alright, the last one is the corrugator supercilii, which are located here in the eyebrows. This muscle originates from the glabella and the supraorbital margin, and it inserts at the skin of the eyebrows. And when this muscle contracts, it pulls the eyebrows medially and inferiorly and forms vertical lines above the root of the nose, forming the facial expression of frowning and pain, as you see here. So that is the muscles around the eye opening. Next, we have the muscles around the oral opening, and these are 10 muscles divided into 5 groups based on the facial expression they produce when they contract. The first group are the muscles on the side of the mouth that produces a smile. All of these muscles have a common insertion point but different origin points. These are the zygomaticus major, which is this one. It originates from the zygomatic bone, as you see here. Then we have the zygomaticus minor, which is this one. It also originates from the zygomatic bone, but more anteriorly. Then we have the soleus muscle, which is this one, originating from the masseteric fascia. So remember we had the masseter muscle for mastication. On top of the masseter muscle, there's a fascia called the masseteric fascia, which is essentially connective tissue forming a smooth surface around the muscle for less friction. So this muscle originates at this fascia. And these 3 muscles insert at the skin of the angle of the mouth to produce a beautiful smile. Next, we have the muscles that either depresses the angle of the mouth or lifts the angle of the mouth. The muscles that lifts up the angle of the mouth are the levator anguli oris, which is this one, and the levator labii superioris, which is this one. The levator anguli oris originates from the anterior surface of the maxilla and inserts at the skin of the angle of the mouth. The levator labii superioris originates from the infraorbital margin of the maxilla and inserts at the skin of the angle of the mouth, and so they both lift up the angle of the mouth. The muscles that depresses the angle of the mouth are the depressor anguli oris, which is this one, and the depressor labii inferioris, which is this one. They both originate from the base of the mandible, down here. The depressor anguli oris inserts at the skin of the angle of the mouth, but the depressor labii inferioris insert at the skin of the lower lip. So these muscles make a sad face, but the depressor labii inferioris depresses the lower lip and pulls the lower lip laterally, which produces an expression that looks a lot like contempt. Alright, so these are the muscles that act on the angle of the mouth. Next, we have a muscle located on the lateral wall of the oral cavity, called the buccinator muscle, which is located here. This muscle originates from the alveolar processes of the maxilla and the mandible, as well as the pterygomandibular raphe, located back here, and they insert at the skin of the angle of the mouth. And when this muscle contracts, it pulls the angle of the mouth laterally, forming a facial expression of satisfaction, as you see here. So that is the buccinator. Next, we have the kissing muscle around the oral opening, which is here. This muscle is called the musculus orbicularis oris, and it consists of a marginal part, which is the outer fibers, and a labial part, which gives the shape of the lips, located here. These muscle fibers are arranged circularly underneath the skin, and they protrude the mouth, forming a kissing face. The last group is the muscle of doubt, and it consists of the mentalis muscle. It originates from the alveolar process of the maxilla and inserts at the skin of the chin. And when these muscle fibers contract, they pull the skin upwards, producing a facial expression of doubt, kind of as you see here. So that was all the muscles around the oral opening. Then we have the muscles around the nasal opening. So if you add the actual cartilages of the nose, the muscles around the nose act directly on the nose itself. So the first one is the nasalis muscle, which consists of two parts according to the course of its fibers. These are the transverse part, which is also called the compressor naris, and the alar part, also called the dilator naris. And they both originate from the anterior surface of the maxilla, and they both insert at the dorsal cartilage of the nose. So the alar part inserts a little more anteriorly than the transverse part. The transverse part constricts the nostrils, and the alar part dilates them, as you see here. So that is the nasalis muscle. The other muscle is called the levator labii superioris alaqui nasi. This muscle originates from the frontal process of the maxilla and inserts at the skin of the upper lip and the skin of the nasal wing. And when they contract, they pull the lips and the nasal wings in this direction, which dilates the nostrils, elevates the upper lip, and produces an expression of discontent. Alright, so finally, let's look at the muscles around the ear opening, which are three. And they look like this. These three muscles are called the extrinsic muscles of the external ear, and these are the auricularis anterior, auricularis superior, and the auricularis posterior. All of these muscles insert on the root of the auricle. The auricularis anterior originates from the temporal fascia, which is the fascia covering the temporal muscle. Auricularis superior originates from the epicranial aponeurosis, and the auricularis posterior originates from the temporal bone. Their common function is movement of the auricle to each direction, as you see here. They really have no practical importance in humans, but they're more important in animals that are dependent on their hearing, like your typical dog that are able to move his ear around. In these animals, these three muscles are more developed than in humans. So that was all the muscles of facial expression. Muscles of mastication. The muscles of mastication, again, consist of the temporal muscle, masseter muscle, medial pterygoid muscle, and the lateral pterygoid muscles. So when the next time you take a bite of the hamburger, these are the muscles that help you mechanically grind through the food inside of our oral cavity. Alright, so the temporal muscle look like this. It originates from the temporal fossa, which is the fossa located on the temporal bone, and it also originates from the inferior temporal line on the parietal bone. The fibers then go down behind the zygomatic arch, as you see here, and attaches to the coronoid process of the mandible, which is here. And so, what is the function of this muscle? When the anterior fibers contract, they will elevate the mandible, and when the posterior fibers contract, they will retract the mandible, as you see here. So that's this one. Next, we have the masseter muscle, which is this one. If you look closely, you will see that it consists of a superficial part and a deep part, but they both originate from the same structure. The superficial part originates from the anterior part of the zygomatic arch, while the posterior fibers originate from the posterior part of the zygomatic arch. Fibers then insert at the mesenteric tuberosity at the mandible, and when these fibers contract, they will elevate the mandible. Next, we have the medial pterygoid muscle, and to see this one, we need to look at the head from this perspective. So the medial pterygoid muscle is located on the other side of the masseter muscle. And what are the origin points? If you zoom in, you will see that it has a superficial part and a deep part. The superficial part originates from the maxillary tuberosity, and the deep part originates from the pterygoid fossa of the pterygoid process. These fibers go down and insert at the pterygoid tuberosity of the mandible. The function of this muscle is either elevation of the mandible if both the right and the left medial pterygoid muscles contract, and if only one side contracts, they move the mandible in a frictional masticatory movement, a grinding movement kinda. Then lastly, we have the lateral pterygoid muscle, which is located laterally to the medial pterygoid muscle. So if you go back to this view and remove all the muscles, and then you remove the mandible, we'll be able to see this muscle very easily. And so this muscle is also divided into two parts. It's divided into the superior head, which originates from the infratemporal surface, as well as the sphenoid bone, and an inferior head, which originates from the lateral lamina of the pterygoid process. These two heads kind of join together to insert into a common area at the pterygoid fovea of the mandible, which is here, right here. The functions of this muscle is to move the mandible forward if both the right and the left side contract together, or produce a frictional masticatory movement if only one side contracts. So that was all I had for the muscles of mastication.